With summer comes the inevitable onslaught of mosquitoes, and this year the persistent pests are packing a public health wallop in the form of the Zika virus. No longer a question of when the virus will emerge in the United States, the focus is now solidly on what can be done to minimize its impact. An all-star panel of public health officials convened at the Wilson Center to discuss what can and can't be done. Their discussion provides the focus for this edition of Rewind.
Over the weekend in the Washington Post, there was an op-ed by Ron Klain, whom many of us know from various roles in government, including as President Obama's former Ebola czar. He has a message for this town. Quote, "Zika isn't coming to the United States. It's already here," unquote. For too many members, this is just another occasion for the blame game. With failures like Flint, Michigan on everyone's mind, I'd have thought there'd be a rush to get ahead of the next preventable tragedy. Because when these public health crises blow up, politicians who drag their heels get embarrassed. But much more important, people become ill and some die.
How prepared is the U.S. to deal with this? We're going into the summer season when mosquitoes are about, both to manage the disease itself and that concern that people have.
We're not starting at a good place. We used to have a lot stronger mosquito control and mosquito awareness, really the surveillance for where the mosquitoes are and the resistance patterns that they have. So we're really have a patchwork nation around mosquito capacity. The state health departments, the local governments are really concerned and are working on this, but we absolutely need resources to get ahead of it. This is the season when the mosquitoes are coming, and so we really have worked out plans of how to be ready and what to do at each step of the way, but we really need to build that up.
It's a very nerve-wracking time for people. Yeah. And when you think about the number of women who are going to get bitten by mosquitoes this summer and are going to be concerned, is the healthcare system and the capacity there to manage that?
You know, every day about 10,000 babies are born, and with Zika, if you've come back from an area that's where the virus is spreading and you're pregnant, we are recommending you see your healthcare provider, that you get a test in the first trimester and again potentially later, but that you actually understand whether you were exposed and got infected or not. But we don't yet know whether babies that are born looking healthy following a Zika infection are going to be developing normally, and so we really need to be able to follow these babies longer term.
And Dr. Fauci, where does things stand in terms of a vaccine that would be able to sort of really put this crisis behind us? It seems like if we could get people vaccinated.
Certainly a vaccine will be important in the long-term solution of how we address Zika, particularly if you have endemicity, where you have a low level of infection in a nation like Brazil. We'll say you'd really want to do with Zika what we have done with rubella. We have made successful vaccines against other flaviviruses. Zika is a flavivirus. Other flaviviruses that you may be familiar with are yellow fever, dengue, West Nile. And so we have a very, very good vaccine against yellow fever, and we have a fairly good one against dengue, and we're working on an even better one. So conceptually, I don't see any scientific roadblock to developing a vaccine for Zika.
Susan, I'm wondering if at Google you're seeing people drilling down in terms of what they're searching for about Zika. Are you getting something beyond just people who are freaking out and are worried about it, or are you seeing that people are looking for specific information?
What we're seeing when people start to look, they're looking deeper, they're asking more questions, and it is mirroring the epidemic. And that's the one thing that we do know a significant portion of time from Google searches, is that when those questions when you take it past the first click, that you do start to see it follows a trend. Usually it precedes a trend. And so that's why we're now at the point where we're starting to shift some of those engineers to the United States so that we continue to work with the World Health Organization and with CDC and UNICEF to try and get a handle and get as much information out to people in the United States, where I think it has been sort of a late coming in terms of our concern, our knowledge. And so now, very recently, you'll see we've put up knowledge panels and directed people to places that they can go. But definitely the intensity and the click-throughs have just grown, particularly here. We can see it in the United States.
We need every country to have a strong frontline public health system where they can detect new problems, they can react quickly, they can prevent catastrophe. If we'd had a strong public health system in Guinea, Liberia, Sierra Leone, we would not have had 28,000 people suffer from that disease. Even in the US, where we have a good system, we weren't as ready as we needed to be for the importation. So between human behavior and the mosquito concern and then these pathogens that just really adapt and evolve and spread, we know we have to be ready for multiple outbreaks at the same time.
It is very frustrating in how you can control mosquitoes when you have, as Ann said, a mosquito species, the Aedes aegypti, that is particularly recalcitrant to the kinds of things we do. So that adds I would say, a dimension of frustration, because there isn't a lot you can do. You can try your best with larvicide, insecticide, cleaning up the environment, but even with that, history has told us that this is a real difficult mosquito to deal with. It's a different kind of public health measure than when you're trying to prevent transmission from person to person, like with a respiratory illness. It's a whole new venue of transmission, which is quite difficult to contain.
For more on this and other related topics, visit wilsoncenter.org. Search under the Maternal Health Initiative and the Global Sustainability and Resilience and the Environmental Change and Security Programs.